That's it.
After they tell my wife that after a couple of years of going back and forth and frankly thousands of dollars, at the end of the day, we call and say, what can you do? And finally they admit, well, we can't do anything for you. So then, we're at the end of the road. What do we do? They recommended no one. They had no suggestions about what to do. She was legally blind in both eyes. So my only hope, in today's world, you get on the internet and you start looking for someone, and I can't remember the exact search term I used, but it was, relief for prior RK surgery or something to that effect. And Dr. Gulani was the only person that, came up that appeared to be qualified out of the whole world. And we contacted him, we got in quickly, and he told us he could help, and he did. He came through with what he promised twice now, and it's been amazing. She can see 20/50 in one eye, and we're still waiting to see what the other one is after yesterday's surgery. It's much improved, and as she said, she can see the leaves on the trees now, read car tags in front of her. She's not afraid to walk with, she's had a fear of falling at night when she was walking. I mean, it's frankly amazing, and it's really disheartening that other doctors don't admit, just say, I can't help you. I don't know how to do it, but I know someone who can. Any professional should say that. If you can't help someone, find somebody, or at least make an effort to find someone who can help them, whether it's an automobile mechanic or a doctor, a lawyer, scientist, or whatever. If you don't know how to do it, at least help
Guide us.
your customer, your client,
Yes.
your patient. Try to help them find someone. And anyone I run into that's had RK surgery, I know they're having problems with it. So Dr. Gulani is going to get my recommendation.
I wish medicine would go back to what it used to be, where doctors actually cared about their patients like you care about your patients, instead of the business model that it's become. Because unfortunately, doctors now,
It's an assembly line.
they make it about how many patients can I see, because I can only get so many patients in a day, and they, they're interested more in making money. And is it any wonder that patients don't have relationships or strong feelings about their doctor? I'll tell you that as a lawyer, one of the things I know is that the rise of lawsuits against doctors corresponded exactly to one phenomenon: when doctors stopped making house calls. Remember when doctors used to make house calls?
Yes.
Well, as soon as they quit, then the feeling changed between patients and doctors. And it has to be the doctors that change it back, because the patients can't. We can't demand any more of your attention. You have to give it to us. And so it has to start with the doctors. And if doctors will make the effort, I can tell you that patients are waiting with open arms. If you'll just meet us part of the way there.
Exactly.
Excellent thought. Well, Sharon, anything?
I agree with what you said. When I go back to the last 3 years of my life when I've been to the eye doctors, I was never given more than 5 minutes of the doctor's time. I was sent with a nurse, a fellow, an assistant, put in a holding tank. The whole process might take 3 hours, but I did not see the doctor herself for 5 minutes. And it's very disheartening. And then they're like, come back in a month, come back in a month. And one time I went back in a month, and she read the same maps of my eyes that she had read the time before, and I'm like, why am I even here? It was just a waste of my time and his money.
You know what I'm amazed about today, just looking at that right now. Just the fact that you are able to go to Alabama today, and your audacity, if I may use that word, right, to even plan that.
Yes.
Well, I mean, to me, that is a whole level, different discussion level. Yes, I'm thrilled with all of you, really.
We're very thrilled.
It's like, been an absolute pleasure, guys.
Thank
All
you.
of you.
Thank you.
Safe travels.
Thank you.
Bye.
Thank you.
Absolutely great. Come with me, please.